discuss Spenddown, please keep in mind that we know that Spenddown is complicated. I personally am not, know very little, if nothing, on Spenddown. We will be following up in the survey evaluation for individuals that want more of an in-depth training. Kristen and others would be happy to just want to caution people that you don't need to know everything on this. Kristen just wanted to share with people at least a little bit on this.
Right, because I think sometimes Spenddown is a grand mystery for folks. And really the reality is we wanted to give you just a baseline understanding of Spenddown because individuals who are applying through this program may qualify through Spenddown. That is an option. So this is meant to be just a very basic introduction. Please keep in mind when I conduct Medicaid trainings, and some of you have participated in those, you know, Spenddown can easily take 45 minutes on its own to really get into the details. And that is not what the purposes of today's training is. We really just wanted to introduce it. And HFS also has some really helpful information on their website about Spenddown. Yeah, let's talk about it. What is it, right? So this is really a program for the medically needy. It's a way to grant Medicaid access to individuals who might be over the monthly income limit for Medicaid under AABD, but they have very high medical expenses, and they can use those medical expenses to bring down their countable income. So that's really what this slide is saying. So when someone applies, it's best to submit those proofs of medical expenses at time of application. And we'll talk a little bit more about some of the process in a moment. So some people like to call it like an insurance deductible. I don't really like that because it confuses issues, but it's just a way to bring down the countable income through the use of medical expenses. Next slide. So this is a very basic calculation, and I am not a numbers person, so bear with me. But basically how it happens is when we submit an application and we provide those medical expenses, what the DHS caseworker would do is kind of look at what's the state standard. There is that $25 income disregard that was asked about that is applied as part of this calculation. And then once we do that, and then we see, okay, they are over the income state standard by about $100 in this example. What this means is that's their spend down amount. And they have to show each month that they have $100 of medical expenses in order for their Medicaid to be activated, if that makes sense. Next slide. So how do you apply for Spenddown? Well, it's just part of the eligibility determination process. But as I mentioned, it's best to apply when you have medical expenses that might meet Spenddown. When someone's application is processed, what will happen is they will be informed whether or not they have a Spenddown and whether or not it was met. It'll include what was budgeted as part of that calculation. And it will also indicate when the first month of coverage begins. And then if the Spenddown is indeed met, they'll get that notification as well and in that notification, there will be information about what medical expenses or which bills were applied to meet their Spenddown. Next slide. And this is something that we can get into more detail perhaps in a future training, but there's some requirements in terms of what kind of medical bills or expenses can be used to meet Spenddown. One of the things that is important to note is that the medical bills that are being submitted must have a date within 6 months. So it could be a very old bill, but as long as it has a current billing date and the customer or that client is still responsible for paying on that bill, it could be a bill from 3 years ago, but if they're still paying off, let's say a $20,000 bill at a hospital and they have a current billing date within the last 6 months, they can use that bill to meet Spenddown and have Medicaid activated. Now, if it is an old bill like that from 2 or 3 years ago, the state can't go back and pay that. What I'm saying is the bill can be used to meet spend down so that they can have Medicaid now. The state, it doesn't matter. The bills can either be paid or unpaid as long as, again, it's been has that billing date within the last 6 months. And I think what sometimes confuses providers, and it certainly confused me when I first started doing this kind of work, is that difference between kind of what's used to meet spend down and activate Medicaid versus what the state can pay. So it's really two separate things. And what I'm talking about on this slide is really when can we use those bills or medical expenses to meet the spend down to then have Medicaid activated. A couple of other things to note is that anyone who is included in the household, if their information was used to determine income eligibility for the program, their medical expenses can be used as well. So a married couple, they're considered a household of two for this program. Both of those individuals' medical expenses can be used. And then there's just a couple of requirements in terms of the medical bill or the receipt, what has to be on it. So of course, the date of service, what was the medical service, what was the provider, so name and address there, and then who was the service for. Next slide. This is just a snapshot or just a few examples of some of the allowable medical expenses. We've also given you a link to the policy on it. So certainly any medical expenses that are not being paid for by the state. So that can be used. If the state's already paying for the medical bill, then that bill can't be used, but other services. If someone is tracking their transportation, medical transportation, at 24 cents per mile, that is an allowable medical expense. Someone who maybe is purchasing over-the-counter supplies. Let's say you have someone whose doctor has ordered them to take Boost or Ensure for nutrition supplement. If you can have a physician's order for that over-the-counter purchase, then that retail purchase could be used. The receipts could be submitted. If someone has a service animal, that cost of care even for the service animal could be used. And then some of the other things here. So value of charity care, that could be used to meet spend down, and many more. So it's a good idea to, if someone is going to qualify under spend down, to kind of track what those medical expenses are. Next slide.
There was one question on this, Kristen. If one spouse has an insurance premium for their own insurance through employment, can that be counted as a medical bill for spend down?
That's a great question. Yes, if that spouse's income was included in the eligibility determination for this program, then yes, that insurance premium could be used. And as you could imagine, that could actually help meet spend down very quickly, depending on how much they're paying in premiums. Thank you. So this slide kind of speaks to what I was talking about 2 slides ago, right? The difference between using a bill to meet spend down and get the Medicaid activated, as opposed to when will the state pay that medical bill. So this is just kind of a side-by-side comparison. Used to meet spend down, again, as long as that bill has a current billing date within the past 6 months. And so we kind of outlined those on the other slide. So just repeating that information here. When can the bill be paid by the state? So really the unpaid bill can be paid while enrolled in Medicaid. And then the second bullet point, the unpaid bills for services 3 months prior to application, that really speaks to that retroactive coverage, that backdating. So let's look at an example on the next slide. So in this example, we have Emily, and she applies for the program on April 1st, and she requests backdating to January. She is told she has a spend down of $100 a month, and she is actually still paying on a medical bill from a hospitalization in the October from the past year. So she's got a current bill. She also was hospitalized in January. So remember, this is April and she's requesting this backdating. When she submits her application, turns in all her medical expenses, what will happen is IDHS, they're the ones who process the Medicaid application. They're supposed to use the bills from October to help meet the spend down for January going forward. And so once she gets notification that yes, approved, and you had a spend down and spend down is met effective January and forever, how long spelled out in the notice, then what has to happen is Emily actually has to go back to her provider and tell them, yes, I've been approved, it's backdated to January, and now the hospital can either submit or resubmit billing to HFS to get reimbursed. I will say this is not necessarily always a very timely process, right? Here she is, she was hospitalized in January, but now it's April that she's applying, and maybe she doesn't find out that she's approved with all of this until May or June. And maybe in the meantime, she's getting bills from the hospital. She's just going to have to communicate with the hospital billing department, explain, she's got the application pending, et cetera. And then once approved, they have to resubmit their billing. I say resubmit because maybe they already did and they got, the denial of the claim. But once they once they approve spend down, they can submit the billing again using her RIN number or her recipient identification number. Next slide. Let's see. And I know there's probably questions, so I'll come back to it. How to submit bills. Again, I've said this, but it bears repeating that it is best to submit the bills when sufficient to meet spend down. I've given you some examples of, $100 a month. I have seen spend downs much higher than that, of $800 a month or $1,200 a month. There may indeed be people whose income is so high that they will not qualify, or they will not have enough medical expenses to meet spend down on a regular basis. So it really is best, rather than submitting, a $50 expense here, and then maybe the next month a $25 expense, and then another month a $100 expense. It really is best to submit medical expenses when you have enough to meet the spend down, if that's something, going forward. Now, I will say this, in many DHS offices, there aren't a lot of people working spend down. It's just the volume of applications and all of that. Last I knew, in the DuPage FCRC, they had 2 workers, maybe 3, handling all the spend down cases for that office. So I want to be realistic here and respectful. What the state policy says is that from the time we turn in the bills with the receipts and the dates and all of that, that the caseworkers are supposed to process those within 2 business days. But the reality is, with the volume of everything, it's just not necessarily always that timely. So there is sometimes a lot of back and forth. That's kind of my point. So as I gave the example with Emily, she may be having to communicate with multiple parties. She's maybe trying to find out from DHS if the bills had been processed yet. She's got to communicate back to the hospital who's billing her. So just to understand the reality that it is not always as timely as we may like to see. And so if you have someone, though, who's being denied services, let's say Emily, needs to have a surgery or something, and that hospital's saying, well, you still owe this bill, and we're not going to plan this surgery because you still owe us. I mean, I would hope that wouldn't happen, but you never know, right? So if there's something really critical, then we need to reach out to the DHS office who's got the case to see about helping prioritize the processing of that spend down. When submitting medical expenses, another thing that can be done is they can indicate the month of coverage that they want, especially if they do have something planned coming up. So she could use those medical expenses for that retroactive coverage in January, or she could use it for a specific month if she knows she has something even bigger coming up in terms of a procedure. But you're probably not going to have to get into that. I don't think too much. Just know it's something that can happen. And if they don't indicate what month they want the coverage to begin, the state will use the date of the bill to really determine the coverage. Next slide. So how do we submit medical expenses, right? So you can fax them in or mail them in to the local office, but you can also use Manage My Case to submit these bills. It's actually in the reporting change function of Manage My Case is where we would go. And this is just a screenshot of that. Next slide. And I know we are running a little short on time, so my apologies if you could just bear with us a little bit longer, and we'll try to move through. For people who have low spend downs, there's also the option to pay in. And so this is actually included in the notice that the customer receives, and they can enroll in the pay in option. So if it's, a $50 a month spend down or even a $100 a month spend down and they can afford that, they can enroll in that, and then they make the payment to HFS. It gets sent to Springfield. Next slide.